Hi there, Russell Tuckerman here, and I'm a men's health physiotherapist, and I work at East Gosford Physiotherapy. And we work with men who have prostate cancer and have had their prostate removed in an operation called a radical prostatectomy. And I'd like to just share with you some of my knowledge about this to help you prepare for such a surgery. The first thing I want to do is talk about the technique of using your pelvic floor muscles to provide the closure of the tube that the urine goes through, called your urethra, so you can stay dry. It's what we do and we've done since we were toilet trained until now, and until there's some interruption of this area of our body, our bladder and our prostate, and we've taken it for granted, haven't even thought about it. We feel the urge, we defer that ability to do a wee by contracting these muscles called our pelvic floor muscles, and we can stop that any leakage and stop any issues with the feeling of needing to go to the toilet. And often then you get distracted and it just goes away. What happens after you have prostate surgery is that system is damaged a little bit, or potentially just traumatized, and we need to restore that ability for the pelvic floor to clamp the tube and keep you dry. So if you are incontinent after having pelvic floor, having prostate surgery, you need to establish the muscle control to maintain that control of that tube. And I talk a bit about a balloon and a clamp. And if you think about the bladder being the balloon and the pelvic floor being a clamp, if there's more pressure in the balloon and less pressure in the clamp, it will tend to leak out. That's what happens when you go to the toilet. But if there's more pressure in the clamp and less pressure in the balloon, then you won't leak. And that's what happens when you have the urge to go to the toilet but want to hold off and not go to the toilet. So keep that in mind when you're going through your rehabilitation or preparing for the surgery, so you understand how to use these muscles and the concepts behind using these muscles. I'll share more information with you in this series of videos of how to do those muscle activation patterns. Thanks very much.